I'm going to start actually with something I haven't done very often, and think about imagination, but also a little bit about Catholic social teaching. And I want to say this in a very humble way, because when I was a kid, and I hope Father Wild will forgive me for saying this, and the other Jesuits involved, I could not in a million years have told you what the corporal works of mercy were. It was something I remember there were 7 of them. Is that right, Father? Good. And I remember that I had to memorize them, but it really wasn't until I went to college, and then through good fortune and really accident, I was talking to students all day today, and we're talking about the way things happen. You can never plan them, but it wasn't until I was lucky enough to go to Haiti that I began to understand what those 7 corporal works of mercy mean. Although the rest of my talk will be about our medical work, I think there is a lot to be learned about imagination, as Stephanie mentioned in introducing me, and about what we need to do to reimagine a world that has so much beauty and wealth, but also some very crass poverty and conditions that really are not tolerable. And they're not tolerable especially for some of the world's poorest. We, an NGO, Partners in Health, wanted to work, of course, with Haitians, and our Haitian partner organization is very large, much, much larger than Partners in Health. It's, as I said, called Amis la Santé, which means Partners in Health in Haitian. But we wanted to help work in the public sector. Why did we want to do that? Because we thought, well, how could people have rights to health care and education? Like, again, I'm going to be drinking out of that water glass very shortly, and I'm not expecting to fall ill with cholera. And I'll be very cross with the leadership of this university if I do. But that's because we have a public water system, right, in this Jesuit university, private university, but we have public water. I'm sure maybe it did come from a bottle and my whole metaphor is ruined. But the point I'm making is you do need public health and public education. Harvard is a private university just like Marquette. But I went to public school for 18 years, and it never occurred to me that I wouldn't be allowed to go to school because my parents couldn't afford it. And those basic rights, some people call them social and economic rights, that's why we, as Partners in Health, decided to shift courses after about 15 years of working in Haiti and really try to focus our effort in the public sector. And so, on the day before the earthquake, this is what Partners in Health Haiti, called Amis la Santé, looked like. From the Dominican border to the coast of Saint Marc, we had rebuilt or built public hospitals that were available to anybody who wanted to show up. And some of you have visited. They vary in size, they vary in design, they vary in quality, but they were there. We weren't overly proud of them, but we thought we'd done the right thing to try and strengthen the public sector. And the need is even greater in education. And then, as you all know, the earthquake happened. Now, the earthquake was difficult for those of us working in Haiti. It was and is difficult to really understand the dimensions of it. And I know many of you have been to Haiti. I've met probably already today 25 people have been to Haiti since the earthquake. But it was difficult well, at least it was difficult for me to go. I was mostly in those early days in the city. And to give you some figures, here's the National Palace. You've all seen this image before. But Haiti had about 29 federal buildings, and 28 of them were destroyed in the earthquake. And there's going to be great disputes before and after about how many people perished. But some people believe that about 20% of all federal employees died or were seriously injured during the earthquake. So that's something that we really haven't seen before. At least I'd never seen or read about anything like this. And this is the only major city where everything was concentrated, mistakenly, of course, but that's what had happened. And I talked a little bit about this with with the nursing faculty and students. But this is what happened to the nursing school. And as you can imagine, almost no one survived in the third-year class, which was inside the building, nor did their faculty. Now, the question before us, or what I've been invited to do here today, is to think about imagination and its role. Because it's very easy, and certainly for those who perished and their loved ones, it's very easy to lose hope. It requires almost a discipline of imagination to see something better in some of these circumstances. And I could be talking about Rwanda after the genocide, but I'm talking about Haiti this past year. This is something that was published by the Inter-American Development Bank, comparing Haiti's quake in terms of loss of life and damages to some of the other disasters with which you're familiar, this Asian tsunami, etc. And so by most criteria, this was a devastating blow to the entire nation. Now, again, I just got some email from a friend in Haiti. It's not clear how many people perished. I've heard, see, the numbers are all over the map. But I can tell you what we saw ourselves. What we saw was a city that was destroyed, and just the mere scent of it was terrible to bear, and most of the hospitals and facilities were damaged or destroyed. This picture actually is of a makeshift hospital that was put up on the first night, and one of my colleagues, who is a Harvard professor, also infectious disease, but she's from Dublin, helped put this together and just worked hours on end just trying to give really first aid, because the complexities of these injuries required teams of surgeons. And the good news is, I think some of you should feel good about this, is that there was a massive international response, including teams of surgeons. Partners Healthcare alone sent about 100 teams down. And a lot of lives were saved. And I think that the acute relief response, there was a great deal of generosity and nobility, and many saves. Of course, losses were even greater. And more than half of all American households donated to earthquake relief in Haiti. But relief is not reconstruction. And that's where we are now. First of all, you can imagine the displacement. And in an already fragile country, huge movements of people out of the earthquake zone into communities that were already stressed in terms of food, water, sanitation. And so it's been, as you might imagine, a very difficult year. Again, the red dots are the places where my coworkers in Partners in Health have been working. And there's a red dot in Port-au-Prince because, as you can imagine, over the years we'd become, with the Ministry of Health, the largest providers of healthcare in Haiti, period. And so for those of you who supported Partners in Health after the earthquake, and there are many people in this room and in this city who did, for those of you who supported our work, I thank you. I think that we did a great deal of good, and we're also committed to working in Port-au-Prince. We're now in these camps. I'll show you a picture in a minute. And as far as I can tell, we're going to be there for a while. Our acute response, for those of you who have been to visit us in central Haiti, this is what the church in the former squatter settlement, now it's no longer a squatter settlement, it's got a big hospital, schools. The church became a trauma ward, and again, there were many teams of people who came down, including a couple from Milwaukee. But that has not solved the problem of how to rebuild the city of Port-au-Prince. And it's going to require imagination to do that. I, for one, would imagine that manual removal of this much rubble is not the best we can do, or that manual pounding of this rubble into dust is not safe or quick enough to meet the needs of rebuilding the city. Nor can people be expected to live in these spontaneous settlements for years on end. This one is called Parc Jean-Marie Vincent, named, by the way, after a martyred priest who I knew, who was killed some years ago. The park was named after him. And now there are about 51,000 people living in these tents. And again, you can see in the foreground, those 3 tents are Partners in Health's temporary hospitals, which, of course, have not been closed since the time of the earthquake. There's a lot to be done, and it's going to require not just imagination, but implementation and coordination. You know that I'm going to show you something that's in my imagination still, but I believe it can happen. First of all, this looks like some kind of artist rendering, doesn't it? It's not. That's a photograph of the hospital that we inaugurated last week in Rwanda. And it is on the top of a beautiful mountain at the site of a former military base. And this is the Butaro Hospital. And what we wanted to do, and this is something that the Rwandan people believe in, I do believe that their leadership, we wanted to imagine something really good, really beautiful, really healing, really modern, and really worthy of the people we sought to serve. And you know, there are naysayers, you don't need to build a hospital like that there. By the way, this district, almost 500,000 people, some people say 400,000. 5 years ago, there wasn't one doctor there, not one. The nurses worked in terrible conditions. One of the clinics had walls made of canvas. And now, this is a medical center. I believe there are 14 doctors there, probably upwards of 60 nurses. There's a women's health center, a NICU, 4 ORs, including 2 big ORs. There's a morgue. There's everything that a modern hospital should have. And it requires imagination, not of one person, but of a team. And that imagination has to be infectious. It has to be spread throughout the people with whom you work. And the people who built this hospital, I'm told almost 5,000 people from that area, locals, worked to build that hospital. They believed it could be done. They weren't just following orders. Yes, they wanted jobs. Yes, they'd never had jobs before. Yes, they wanted to learn how to be masons or carpenters. But this is what can happen, I believe, when we set our standards high instead of assuming that we can't do better by the poor. And so here's my dream, and the one I'm unveiling to you and asking for your help. I think Haiti, after what it's gone through, and not just this past year, although it's been the worst of many, but for a long time, deserves at least one, and many, in my view, world-class medical center. It deserves teaching capacity in medicine and nursing and allied health sciences. And so this is what we propose to build with an even bigger coalition in the middle of central Haiti. I would say that this is just an imagination. Some people would say the product of an overactive imagination. But I know it's not true. I was there on Saturday, and there I saw scores of, probably this is Saturday, and I think I saw about 80 people working on the site. I saw a handful of very experienced contractors from the Dominican Republic. I saw a Haitian American, one of my medical students from Harvard, Dr. Walton again, native of Chicago. I saw so many people gathered there working on this project. And so my bet to you here at Marquette is that this is not just an overactive imagination, that in 18 months or so from now, let's hope we see something looking very similar to this picture, but that already looks like this now. Thank you very much, and I look forward to our discussion.